Hello, my name is Steve McCallie, and I am a medical science liaison with Reata Pharmaceuticals. Today, I will be discussing the FALCON trial, a study of bardoxolone methyl in polycystic kidney disease sponsored by Reata Pharmaceuticals. Listed here are relevant disclosures. Please note that bardoxolone methyl is an investigational product and is not approved for use by any regulatory agency, including the U.S. Food and Drug Administration. Safety and efficacy have not been established by any agency. The FALCON trial is a phase 3, placebo-controlled, double-blind, global trial. Let's break all of that down. Phase 3. This means that it is a large trial and will focus on the long-term safety and efficacy of bardoxolone methyl, or BARD, in ADPKD. The FALCON trial will enroll up to 550 patients by the end of this year, and will evaluate patients on treatment for 2 years. It is placebo-controlled, meaning that half of the participants will randomly be assigned to receive bardoxolone, and half will be randomly assigned to receive placebo. It is double-blind, meaning that neither the participant nor the doctor will know whether they are receiving BARD or placebo. And it is a global trial with trial sites throughout the US, Europe, and Australia. The experimental treatment during the study will be given in the form of an oral capsule, taken once per day. The goal of this study is to evaluate the long-term safety and efficacy of BARD by measuring eGFR compared to baseline at week 52 and at week 104. Here we have listed some of the key eligibility and exclusion criteria. Among other eligibility criteria, patients may be eligible for this study if they are 18 to 70 years of age, have been diagnosed with ADPKD, have a measured eGFR between 30 and 90, have a stable blood pressure of less than 140/90. Note that if a patient is receiving angiotensin-converting enzyme or ACE inhibitors and/or angiotensin II receptor blockers or ARBs, they may be eligible for FALCON as long as they are receiving a stable dose for at least 6 weeks prior to their first screening visit. FALCON will exclude patients who have had stage 4 chronic kidney disease and other risk factors, patients who have received tolvaptan within the last 3 months, women who are pregnant or breastfeeding, transplant recipients, and patients with a history of heart failure events. A complete list of inclusion and exclusion criteria for FALCON can be found on www.clinicaltrials.gov. As I mentioned, patient participation in FALCON will last for 2 years, so let's take a deeper look at that. Patients will complete 2 screening visits at one of the study centers to ensure that they meet the eligibility requirements for the trial. If they do, they will be randomly assigned to either bardoxolone or placebo in an active capsule. This process of randomization is represented by the letter R on the left-hand side of the figure in this slide. Patients will take their study drug or placebo every day for 48 weeks and then go through a 4-week withdrawal or washout period, represented by the W/D in the figure. After those 4 weeks, patients will go back to taking their study drug or placebo for another 48 weeks, followed by another 4-week withdrawal. At the end of the trial, the group of patients assigned to bardoxolone methyl will be compared to the group of patients assigned to placebo in order to help researchers better understand the effects and safety of bardoxolone methyl. The washout period has been incorporated into the trial design so that FALCON researchers can better understand if BARD causes any lasting changes to the kidneys without the influence of the drug. After completing a full 2 years of participation in the FALCON trial, patients may be eligible to roll over into an open-label extension study where they are guaranteed to receive BARD until it is commercially available or until the study is terminated. In total, patients will complete 18 visits to a trial site and 6 phone calls, with most of those being in the first year. Patients will be monitored especially closely during the first 2 months of the trial. All participants, regardless of whether they are on BARD or placebo, will follow the same visit schedule and will be asked to complete the same study procedures. Additionally, study visits and procedures will continue throughout the open-label extension study. Throughout participation in FALCON, patients can expect to complete procedures such as vital sign measurements, blood draws, urine collection, kidney pain assessments, and more. To learn more about the study procedures, please visit www.pkdstudy.com. Throughout the study, patients will receive the investigational drug and study-related procedures at no expense. Travel expenses will be covered, and participants may receive compensation for their time. For example, you may be compensated for your time in travel, including airline and lodging costs if these are needed. As with all clinical trials, patients will complete informed consent, where they will receive all the adequate information to allow for an informed decision about participation in the trial, including potential risks and benefits. While enrolled in the clinical trial, patients will continue to receive their normal routine care. Patients may also withdraw from the study at any time for any reason. There are FALCON trial sites located throughout the US, Europe, and Australia, as seen in the maps on the right. If you would like to be a participant of the FALCON study, check out our interactive map at www.pkdstudy.com to find the trial site nearest you. You can also visit pkdstudy.com to answer a brief questionnaire and find out if you are pre-qualified for enrollment. Patients are always encouraged to consult with their physicians about whether participating in a clinical trial is right for them. You can also find more information about the FALCON trial on the PKD Foundation's website or by visiting www.clinicaltrials.gov. Enrollment in FALCON began in May 2019, and while enrollment was halted briefly due to COVID-19 pandemic, the trial is enrolling quickly. As of the time of this recording, over 290 patients have already been enrolled in FALCON, and enrollment is expected to complete by the end of 2021. We hope that you found this information helpful. If you have any questions or would like to know more about the FALCON trial, you can connect with us via email at falcon@reatapharma.com. Thank you so much for your time and attention.